Hi everyone, my name is Dr. Catherine Backus and today I'm doing a video on how to use the Saxenda pen. So Saxenda comes in a pen that looks like this. It's got a little outer covering here. We've got the ability to give the medication by pressing this button. We have the ability to dial up the dose by turning this little part of the pen. We have a dosing window here that shows you the actual dose that you're going to administer. And then we have the canister which has some clear fluid, and there's a plunger that goes down as the medication is dispensed. You'll know that you finished the medication if you can't dial up the pen or the plunger is at the hilt here. And then we have the ability to pop a needle tip on the end which just simply screws on. When you get the pen, you'll be given some needle tips to go with it. What you want to do, the needle tips have two plastic coverings. One's an outer cap that can be discarded and dispensed of. It's also got a little inner cap as well. And so what you want to do is peel off the paper and then you simply screw the needle tip on onto the medication after you've taken the paper tab off. So that simply screws on like that onto the pen. And then we just remove the outer cap when we're ready to, the inner cap when we're ready to dispense the medication. So what we do now to dial up the medication, the first time you use the pen, you just need to prime it. So there's a couple of small little notches there that you'll see, and that's just to check that the fluid is working. So when you've dialed up those notches, you just click the bottom and make sure that there's a couple of little drops of fluid on the end there. When you're ready to do your proper dose, you just keep going until you've dialed up to see 0.6 come into the window there. And then when you administer it, you pop it into the soft tissue. So we would normally use it on the tummy, the inner arms, the inner thighs, and in that way you're getting the medication into the subcutaneous tissue in those areas. So when giving it, you actually just take off the outer cap, you've popped your needle tip on, you've taken off the outer plastic cap, now we're going to take off the inner plastic cap. You've dialed up your dose here to 0.6 and then we're going to pop it into the soft tissue. We hold it like a little bit of a monkey grip with our fingers ready to go here, and then we simply press down and hold for 6 seconds. So counting to 6, and once you've done that, you can simply remove, and then you just need to dispense of the needle tip. But you do that by just unscrewing that part there, and you'll need to get a sharps container from the pharmacy or from your local government. And when you've filled that little container, just return to the pharmacy or the local government agency for dispensing of those sharps needles. That's really important. So that's how to use the Saxenda pen. I hope that's helpful, but if you do have any questions, please have a chat to your doctor.